In order to analyze the SI joints, I would start with visualization, looking for scars, bruises, lesions, any trauma, anything that might be abnormal. I'd then do static palpation, looking for differences in musculature, temperature, and any abnormalities. Going below the waistband, is that okay?
Mm-hmm.
Feeling for different temperatures below the waistband. I'd then move into motion palpation, looking for any restriction. I'm going to start with the 8-point check, looking for if the ilium or the sacrum is subluxated. So I'm going to start with the 8-point check. Is it okay if I go below your waistband?
Of course.
So I'm going to be on PSIS and S2. Go ahead and lift your right leg, and then your left leg. And then I'm going to go to the other side. Go ahead and lift your left leg, and then your right leg. And then I'm going to go to the lower boot. Go ahead and lift. Good. And left. Good. And lift. And lift. Good. So I'm looking for normal motion of the PSIS and the S2 should separate. If they don't separate, that could indicate a subluxation of the ilium or the sacrum. I'd then move into forward flexion. Go ahead and face that direction for me. Is it okay if I contact below your waistband? I'm going to contact PSISs and ask the patient to bend forward. Go ahead. Good. I'm then going to ask the patient to bend to bring their hand into their pocket. Nope, bend with their hand down there. Yep, good. And then again, down to the other side. Good. And then I'm gonna ask them to rotate. Good. Without moving your pelvis, I'm sorry. Go ahead and rotate again. Good, and good. Normal motion is the PSI should remain level. If there is any discrepancy, that indicates the side of subluxation. And you'd also want to do axial rotation, which I'd have the patient sit down for. Go ahead and sit. I'm going to be on PSIS and S2. I'm going to ask the patient to cross their arms for me, and then I'm going to rotate them towards me. And again on this side. And those should separate normally. This is how I would analyze. I'd then use a leg length discrepancy as well as glute fold check. Go ahead and stand for me. I'm going to contact your glutes. Is that okay?
Mm-hmm.
I'm going to use glute fold. A lower glute would indicate an AS. A higher glute would indicate a PI.